Dave, we are in the discussion segment.
Well, with all due respect, I've heard nothing that would solve the problem. We have two problems. First of all, you've got 55 million people who don't have health care. We've got an obligation to see to it that they do. Secondly, if you want to control cost, you've got to see to it that medicine engages in best practices. There are all kinds of treatment regimens that can cost a whole lot more, that will cost a whole lot more than are necessary, and there are some that can save a lot of money. What you need to do is to increase the research on what those best practices are, and then disseminate that information throughout the medical community.
More earmarks.
Second, it doesn't have anything. Do you know how anything besides slogans has nothing whatsoever to do with earmarks?
Mr. Obie.
Are we talking about health care, or you want to switch the subject?
It seems like everything we talk about, it has the money's the answer. The money's the answer.
With all due respect, no.
With all due respect, Mr. Obie, we don't have the money for all those answers.
Right now, every person with insurance is paying about 20% more each year to cover the cost of the uninsured. Right now, if you're uninsured, you walk in an emergency room, you get treated, that cost gets shifted to the paying customers. We will never get control. We will never get control of health care costs until we have universal coverage, so that we can stop the incredible.
Where does this end,
21% of all of them.
Where are you going to end?
21% of all the money that's spent in this country today on health care is spent by insurance companies to deny health care to somebody. You've got a fight going on between the lawyers and the actuaries. You've got a fight going on between the hospitals and the insurance companies. We've got to get that out of the system by providing universal coverage.
Government's going to solve that. They're going to take the money out of our pockets.
Government is not going to run the program, but they are going to set the parameters. We believe in a privately run. We believe in a privately run program supplemented by government help for people who can't afford it.
Medicare and Medicaid, you're already delving into the idea of telling them when they can and what they can take and what they can't take. Designating where they go.
Does that mean you'd abolish those programs?
What it means is government needs.
Would you abolish those programs?
I would not take away people's rights and freedoms so you can save a buck and then spend it on something else foolishly.
Programs?
No, I would not abolish those programs. And I would not pay only partial out to the hospitals. You're ripping off the medical profession. You're ripping off the taxpayers.
Oh, so now you're saying we should raise the cost of Medicare by 25%.
No, I'm saying you pay your bills just like we pay ours, Mr. Obie. I don't get to go to the hospital and say, here, I'm going to pay you 75% of cost. We don't get that right. You do, and we pay it. That's the problem.
So where are you suggesting we... Well, I don't understand what you're saying.
If you can't vote on an issue that you can afford to take care of, then maybe you shouldn't vote on an issue. You're spending money foolishly everywhere else with your earmarks. Put that money to where it should be.
So you're saying because Medicare is such a bad program,
rather than $700 billion going off to someone we don't know, I'd rather see that go to pay the full fare for the Medicare and Medicaid costs and reduce our health care costs by 33%. That would happen. So would I. Then do it.
But when the economy is going down in flames, you've got to do something besides yap yap.
Yeah, I know. You run in circles like and cry, oh my, oh my, oh my, and then you vote. That makes the solution work. You don't know what you're voting on. You don't know where the money's going. You don't know what the issue is. But we vote, and we give out the money. Mr. Obama just recently spoke to how he was going to spend it in January. But, oh, it's a fire. A fire that gets spent in January?
Dave, you've got 10 seconds, and we're going to move on.
Not worth it.
Let's move on.
Finally, I got him to see the light.
Let's move on to Todd Hicks.
Representative Obie has been in Congress since 1969, and this would be Mr. Mielke's first time in public office should he win. You know, many could say that this election boils down to getting some new blood into Washington versus having veteran politicians. Which is the better way to go for America right now?
Oh, by all means, vote for Obie. No, I'm kidding. Sorry. The situation is we do need to make change. Congress has the lowest popularity rating in its history. And it's not because they're doing a wonderful job. It's because people are fed up with the way government is running. It's always spend, 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 and the solutions don't seem to come. They don't seem to help solutions. They seem to create them. And I believe that's where we have our problems right now. And we have to stop that. New blood in Congress is what we need. We need to shake it up. We need to get some new thoughts in there. You name one industry or one business that sits on the way they were 50 years ago, 39 years ago. They get new blood in. They get new ideas and new concepts, and they make changes. Doing the same thing over and over and over again for 39 years, I agree with Einstein. It's insanity. And we need new people in there, new ideas and new concepts to come out. Some of those may not be the best, but they sure can't get any worse than the ones we got now. Congress is not helping us, and they need to change that.
Dave, you've got 90 seconds.
I would simply say I've been an agent of change since the day I walked into that building. I rewrote the code of ethics for the Congress, under which 19 members of Congress have been disciplined. I changed the way appropriations members are elected, so that they are elected democratically rather than simply rising by seniority. I won the chairmanship of the Appropriations Committee by bucking the seniority system and beating somebody who was far more senior than I was. I think we desperately need change in Washington today. We need to change tax policy, which right now sticks it to middle-income Americans and rewards the wealthiest people among us. I think we need to change tax policy that this year is giving $50 billion in new tax cuts to millionaires, while the president is trying to cut back on cancer research and health research. I think we need change in energy policy so that we can recognize our international responsibilities with respect to global warming, and also see to it that we develop new sources of energy rather than simply relying on oil, because we've got two oilmen named Bush and Cheney who were running the government for the last 8 years. So I will take a back seat to nobody when it comes to being for change.
Todd Hicks, do you have a follow-up? Gentlemen, you've got another 3 minutes to continue discussing
the situation. He talks about the wealthy and the poor and how we're not treating everybody fair. It's my understanding, Mr. Obey, that the wealthy are taxed at a higher rate of percentage than the middle income. I don't see that as they're getting less. You keep looking at their money like it's your money, and you figure, well, they can afford to give out more, we're going to get more out of them. I disagree with that. I don't believe that we have a situation you're talking about, and I'm not even in your middle class. And I know what I'm saying. The fact of the matter is the wealthy are being taxed. They're being taxed at a higher rate than everybody else. Your idea of putting a higher percentage on them so you can take the money and help us make money, you know what? I'd rather work for that guy. I at least know what I'm going to get.
The fact is that since George Bush walked into the White House, 95% of all of the income growth in the country has gone into the pockets of the wealthiest 10% of people in this country.
That's why we're trying to remove those congressmen.
That means that all the rest, 90% of Americans, are fighting for table scraps.
This is the problem,
for an
Mr.
additional
Obey.
5%.
This is where I have a major problem.
I think we need to change tax policy so that we
you
can go
don't
back
see
to the
our
tax
money as
rates
our
that we
money.
had.
You see our money as your money and how you divvy it up.
With all due respect, we're in the state of Bob La Follette. Bob La Follette invented the idea of taxation based on ability to pay. I agree totally with Senator Obama, who believes that we ought to be providing a tax cut for people who make less than $200,000 a year, financed by a modest tax increase.
Where are you going to get the money that you cut? Okay,
I'm trying to tell you. We would finance that tax cut by increasing taxes back up to the rates they were under Bill Clinton for those who make more than $200,000 a year. That's very simple.
And what would that rate go to? 50?
39%.
Okay, and what is it now?
35.
Whoa! That's going to take care of that.
Yes.
Obviously, then the wealthy are paying most of the taxes, aren't they?
The wealthy are not paying nearly as many taxes as.
This is the problem that we have. You pit us against each other. You get us to dislike the wealthy and the poor, the blacks and the whites.
I don't dislike the wealthy. I would like everybody to be wealthy.
Why can't we work as a team? Why do we have to stick someone to help someone else?
With all due respect, I think you have to ask who can afford to bear a higher share of the load. If we're going to, the president borrowed $1.2 trillion to pay for tax cuts. He borrowed it all. He borrowed $600 billion to pay for the war. I think those things ought to be paid for, and I don't want them to have to be paid for by people with the least ability to pay.
Can I step in here with a follow-up?